If you're a mother or a father, or if you're a mom and you're pregnant with your male child, please listen attentively to this information. We know that childbirth comes with many anticipation. The couples involved tends to anticipate for the kind of care and love to render to this child. So before you get discharged from the hospital, there is an examination that is very, very important that you have to carry out on your male newborn baby. This examination will actually save this baby from potential testicular cancer, infertility, and many other male reproductive health conditions. And this examination lasts for a few minutes. That is, it doesn't take much of your time. It can be carried out by the mom, the father, or your relative, and even the healthcare provider that assisted in the delivery of your newborn. So if you're a mom and you are 2 weeks after childbirth and you can't carry out this examination, you can ask your relative, your partner, or your healthcare providers to assist you in this examination. This examination is being done to detect an undescended testis. Normally, the testis of your child ought to descend before childbirth. So how can one carry out this examination? Gently take off your baby's clothes. Be sure that you wash your hands, that your hands are clean. Using your fingers, gently palpate the testicles of your baby. The testicles are located inside the scrotum of your baby. The scrotum is that sac under the penis of your baby, and inside the scrotum are two balls which are called the testicles. You ought to palpate for these two balls. If you notice only one ball, that is one testicle, you need to report this to your healthcare provider. And if you also notice more than two testicles, like 3, 4, 5, 6 testicles, you should also report this to your healthcare provider. Your baby testicles is meant to be two in number, not more than 2 or less than 2. So anything greater than 2 or less than 2 is a sign of an abnormality. You have to report this to your healthcare provider. And also, if you have already been discharged from the hospital, that is, if you're at home already with your male child, you can as well carry out this examination on your baby. The presence of one testicle, 3, 4, 5, or 6 is a sign of an abnormality. It has to be 2 testicles. Remember that this examination is very, very important because it can save your baby from potential testicular cancer, infertility, and many other male reproductive health conditions.